Now I'll get back to Catherine here and let you pose a question here for our candidates.
Sure. From 2007 to 2010, the Women's Health Program produced a net savings of $88 million here in Texas. Do you support Texas ending participation in the Women's Health Program that saved our state money and provided a $9 to $1 federal match in funds? This decision will, of course, result in about 250,000 Texas women losing access to health care.
Mr. Dale.
Well, I'm not sure if the premise of the question is right. I mean, Texas participates in a women's health program. There's over 1,000 vendors that are in it today. So there is an existing program out there.
But we've chosen not to participate in a specific form of that program that will bring in $9 to $1 in federal matching funds.
I'm not sure which part you're talking about.
Sheila, do you think?
Yeah, I'll take on that question. It's a targeted attack on Planned Parenthood that the state legislature had, and that's why the funding was cut to that. They also cut the funding to the Texas Family Planning Program as well. You know, I've got signs up around the district that say fiscally conservative and socially liberal, and this is an example in the state where they're being socially conservative and fiscally irresponsible. To ignore that federal matching dollars is a mistake. And as far as the Texas Family Planning Program goes, we cut that budget by about 2/3 in a targeted attack on Planned Parenthood. We cut it by about $70 million. Now, because of those cuts, over 300,000 mainly low-income women are going to lose access to preventative care and family planning services, and about 20,000 additional Medicaid-eligible births are going to occur. That's going to end up costing the state of Texas $150 million. So we're going to pay more in the long run as taxpayers to be socially conservative and fiscally irresponsible.
If you're talking specifically about Planned Parenthood, I mean, really what it's about abortion. It's not about women's health. And the claims that come in from Planned Parenthood are about 2% of the total in the state. Okay, they're the #1 abortion provider. And whether someone's pro-life or pro-choice, there's a lot of people think that taxpayer funding of abortions is just inappropriate.
But it doesn't happen. There is no taxpayer funding of abortion.
The subsidy that the state provides allows them to do that business, and you know without denial that they're the #1 provider of abortion in the state of Texas. In that program, $40 million was that program. 10% of it came from the state, 90% came from the federal government. When the state said they didn't want to fund that, the federal government removed the rest of that. But as I said, there's over 1,084 providers here in the state of Texas that provide that kind of medical care. So to say that women are going to go without care is just not true.